It is my pleasure to welcome Dr. Mercy Mwangangi, the CAS. Finally, say thank you very much. Welcome, Doctor. Thank you very much.
Let me begin by congratulating everyone who's made this possible. For the investors who've put in their hard-earned resources for us to be here today to launch the maternity wing. For all the milestones that have been shared today for Komarock from the beginning, 2004 to where we are today. For ensuring that there's a footprint of KMH, not just in Nairobi County, but also in Tharaka Nithi County, which is what we like to see and encourage as government. I'd like to appreciate the workers, the healthcare workers who are here. I remember in the morning I was being introduced to the senior management team, and they're all beaming, very excited to welcome us to their facility. The nurses, the doctors, the clinical officers, who clearly are working as professionals, who clearly are dedicated to their work. It's quite evident. When we toured the maternity wing, I talked to some mothers and they're all saying, we are happy. And so thank you for really making it possible, all the workers who work here and who ensure that this engine is able to produce good outcomes. I'd like to appreciate all the friends who are present here. It's important, and sometimes often the public doesn't appreciate all the stakeholders that go into making a health facility successful. Now, last year, March, when we all became, should I say, routine faces in your screens, we had an engagement with Waziri Mutahi Kagwe in his office, one of those late nights when we were trying to figure out what do we do about this COVID-19 issue. And we were there with DG Amoth and a whole team of technical experts in the Ministry of Health. And we were discussing some of the investments that are needed. We were discussing some of the gaps that exist. For those of you who are in the practice of medicine, you all know what is known as an ECMO machine. I think Dr. Nyamu knows about an ECMO machine. An ECMO machine is one of the sophisticated machines that can actually take out all of your blood, oxygenate it outside, almost keep you in almost a frozen state, and get it back in you. It's a very sophisticated piece of equipment. And in the country, we only have 2 people who can run ECMO machines. But you need 4 to run an ECMO machine because it's a minute-by-minute sort of procedure. And when we were trying to determine, okay, if everything goes wrong, as they say, if it all goes to, and I won't use that word, but if it all goes to that, how will you ensure that our Kenyans are protected? Do we have all this? And we had a long checklist, and everyone was there rapping, trying to share all the needs that were needed. And Waziri was listening, listening behind his table, listening to all of us, the doctors in the room. He's not a medic. And he said, okay, after all you've said, all the mambo jumbo, all the sophisticated things that you're talking about, what I'm hearing is that at the end of the day, you guys just want to put a smile at the patient's face. You can imagine how he minimized all those technical jargons that we were sharing with him by saying at the end of the day, you guys just want to ensure that the patient walks out with a smile. And if you've heard what Dr. Nyamu has said since he came here, if you've heard what the MD has said since she stood on this stage, this facility's main aim and agenda is to put that smile on a client's face. And really that is the calling in the medical profession, and I want to thank you for ensuring that that ethos remains at the back of your head, even as you move forward as an entrepreneur. There are certain hidden and unseen collaborations that happen between the private and public sector. When we look at cancer units, I really do look forward to coming here to relaunch and to, celebrate another milestone of KMH. Today we are here to celebrate a maternity unit. Again, through the Linda Mama program, we've put aside every year 4.2 billion Kenya shillings that go to the Linda Mama program to ensure the mother who cannot afford that NHIF card, the 500 shillings, is able to get care. And I'm hoping, Dr. Nyamu, you're part of that. NHIF has accredited you to be able to offer that service here, and that is a good thing. And so really, it is to come here today to say then, therefore, one of the approaches that we really champion, in fact, one of the things every time you're engaging with His Excellency, the President, is, are you engaging private sector? Are we supporting each other to ensure Kenyans get the care that they need? And that is why when Dr. Nyamu called, I said, yes, I'll come in, because it's a demonstration of our continued partnership. particularly with private facilities. Many of you may not know, but in Kenya, healthcare provision is almost on a 50-50. So for every public facility you see, there's a private sector facility that is supporting it or an FPO facility. And so I'm here standing telling you as government, we are well sure that we cannot do it alone. And that is why we come here to support such partnerships and to ensure that they thrive. Now, the other important thing that we need to talk about again is the lifestyle issues. I'm so excited about the Nutrition Center. Last week, we launched the Kenya National Dietetics Institute. It's just a stone throw from you. And one of the things that we're talking about is we need to invest in nutrition. The medicine of the future will take your blood, we'll do genomic typing, and we will determine what diet or what nutritional lifestyle is useful for you. That's the future of medicine. And so I'm hoping to come and support you as you ensure that that endeavor moves forward. Now for maternity, which is so important. About 10 years ago, one of the most dramatic things that has ever happened to me as a clinical doctor and not as a corona doctor is when I lost a mother on a table. This is after 3 assistants had come in, including the consultant, and we were trying to fight to save the life of a woman who had lost so many previous pregnancies, and this was her precious, precious baby. We saved the baby, but we lost the mother. And we lost the mother because of so many factors. Amongst them, access to care. She came in late. Factor number 2, we did not have enough blood in the hospital. Factor number 3, there were delays here and there in terms of care. And so I can tell you the significance of putting up a building here that offers all these services at hand is so, so crucial. We always say in public health that investing in a mother, investing in children, is the only way the country can move forward. And so we continue to support you, Dr. Nyamu. The investment that you're putting up there in the maternity unit is not in vain. Even beyond the resources that come into play, it is not in vain. Saving a mother's life and ensuring that at that critical hour, you actually have a skilled worker there to support you. Kenya has made gains. I'm hoping you do usually report to the public health system. And so your data would be important. I know we're at 70% in terms of the number of mothers who deliver with a skilled healthcare worker. And so these partnerships help to ensure we drive that number higher and higher. And as I conclude, I think the last thing that I would say is that PPPs are so, so essential. Public-private partnerships are so, so essential. I'm completely impressed by what you've done, Dr. Nyamu. One, because I know what it means to put together a hospital. I also have an entrepreneurial hat, which I had to put down once I got this posting. But I know what it means, guys, for you to be running around, looking for supplies and oxygen. So for you to have 4 facilities, that's no mean feat. But importantly is to say that these collaborations need to be extended further. These collaborations need to link into the government systems. That a level 3 health center will refer to KMH in Tharaka-Nithi is what we're encouraging. And again, also, once you finish taking care of that patient, that you'll refer them back to their health center for now the basic primary healthcare services that they need. That is so crucial.